What is senior living placement? I'm Mark Schmidt with Home Care Assistance of Tucson. Welcome to Tucson Dementia Dialogues. When a loved one is diagnosed with dementia, such as Parkinson's, Alzheimer's, or Lewy body, relatives often have a multitude of questions and concerns. We are here to answer as many of these questions as we can and provide helpful local resources to help support you along the way. Today, I have Amanda Gillette with a Senior Journey here to tell us about senior living placement services. Thank you for joining us, Amanda.
Thank you for having me, Mark.
Appreciate you coming in.
Thank you so much.
Can you tell us, first of all, what is senior living placement?
Yeah, so I've been likened to a matchmaker or a realtor for people looking for independent living, assisted living, memory care communities, and adult care homes. Okay. So it's a free service that helps people locate those things, and the way that works is we have contracts with various places, and when somebody comes into a place that we've shown or recommended, they give us a referral fee. And we do an assessment to determine somebody's physical, geographical, and financial needs. And then based on the information we get, we set up a tour in the appropriate settings, and then we physically take people on tours and show them the different places. So it's helping them to really narrow down the search and find the right place that's the best fit for them.
So of these different communities that you work with, are you actually employed by them, or are you an independent contractor, or are you just an independent company that works with them?
Yeah, that's a great question. So we actually are not employed by the company. We're like a third party. We represent them all. And so I have contracts with all the different places. That doesn't necessarily mean that I use all of them, because what's really important to us is looking on the Arizona Department of Health Services surveys, seeing that they're licensed and that they're also in good standing with the state. That's very important to us.
Okay, excellent. So you mentioned just a little bit ago, it was a free service. I think you said that they pay a fee. How is this a free service to someone? They are needing help to let's say, find a place that they want to continue aging in a community. How is it that you don't charge for that?
Well, so the communities do pay us a fee, and like I said, I represent all the different communities, and I get different fees from different places, but that doesn't mean that I am selecting the ones that I get a higher fee from. For me, what's really important is just finding the best fit for somebody. So sometimes that'll be an assisted living center, sometimes that's just a smaller home, and it depends on what the family's looking for and also the care needs of the client.
Okay, so you talked about meeting the client and the family and kind of doing an assessment and determining what are their plans and their current situation. Can you tell me a little bit of what that looks like? I mean, is that like a one-time meeting, or do you need to meet them over a period of time, or do you meet with their doctors? I mean, what all happens with that?
Sure. So the process of doing the assessment can be a few different ways. I do have a lot of adult children that live in other states, and so we can have a conversation on the phone. Sometimes the parents want to be involved, or the actual clients are the ones that are my clients having this conversation. So we can either meet in their homes, at a coffee shop, or we can do it over the phone. The purpose of it is to really find out what their needs are, what they need help with, what they're looking for. Sometimes we want somebody they want a family dog in the home, or they want a room with a view, or a fountain in the backyard. So all these things, we want to help fit them into the right place based on that.
So are you saying that if we had a senior and they did have either a dog or a cat, that some communities would allow them to have that dog or cat with them?
Yes, all the centers will allow somebody to have a pet. A lot of them have a weight restriction, but they can have that as long as they're able to care for their animal. There will be a one-time pet move-in fee, but yes, they can do that. Most of the homes are not allowing pets just because it can be a trip hazard for some of the seniors with the smaller dogs. But yes, they can have their pets, so that's a good thing, because many people love their pets and can't part with them when they do go to independent or assisted living.
Okay. And when you meet with them and you do the assessment and you've talked with the family, and you obviously go back and start thinking about all these different places. When we talk about a city such as Tucson in our metro area, About how many different communities are we talking about that you have to have in your head that are spinning through?
Yeah, there's about 250 adult care homes. They're also called assisted living homes, and they're never licensed for more than 10 people. They would look like a regular home you'd see in someone's neighborhood, and so a lot of times they don't even identify as an adult care home, but those ones are licensed, again, the ones that we use. And then there's the centers. There's about 50 assisted living centers and about the same in the independent living centers. So there's a nice selection of places out there.
Wow.
And there again, we're also working within people's budgets, given that it's reasonable. So we can a lot of times help negotiate price, and then also for added services, we can help negotiate that too.
So I just want to take a moment when you're talking about price. Again, when we're looking at here in Tucson, can you give us a general, I mean, you started talking about the smaller like group homes that can have up to 10 people. Can you give us a rough idea of, if you're planning to do this, how much per month are you looking on a low side to a high side? And then my second question is it deal with how new the property is? Is that how it gets a better score? Like if someone just opens a brand new, oh, they're more modern, so they get a score. What things are they looking at to get those scores? And then how does that affect the rate that they're paying?
Yeah, that's a good question, and I do get asked that a lot. So I would say you have an option of sharing a room with another person or having your own room. So the shared rooms are about $3,500 to $4,500 a month, and that includes everything. That's not just the rent, it's the care as well as living there. That's all assisted living is month-to-month contract, so you're not locked into anything long-term.
Okay.
They do ask for a 30-day move-out notice. And then the centers, you can either have a studio, 1-bedroom, 2-bedroom, but they are based on the rent. That's a separate price, and then whatever level of care is, that's going to be an additional cost.
Okay.
So as far as the adult care homes and how they set the price for the private rooms are anywhere from $4,500 to $10,500. And it's not about the care, it's about the home. It's the high-end homes are more expensive, and then the more modest homes are going to be less expensive. But for us, what's the most important is that it's clean and has good care, and so you can have that in either price range.
So sometimes just because it's more expensive, the care may not be at the same level that you may get somewhere else at a slightly lower rate.
Yep.
Whereas you're taking a look at, okay, what is the quality of the facility? You know, how does it look? What is its structure? But what is the care that they're actually receiving? And that becomes an important criteria in the judgment.
Absolutely. Yeah, and there can be lovely, like very expensive homes and have great care, and then a very modest home, same thing, have great care and still be clean and paying a fraction of the cost. So it's really about where people feel most comfortable in living.
Okay.
And what they can afford.
To your knowledge and base, like when we're talking about, because some families, they're split between Phoenix and Tucson or Flagstaff, to your knowledge, is there a big difference in the pricing between Phoenix and Tucson, or is it just all over the board, just like Tucson's kind of all over the board, and then that's just how it is?
So in Phoenix, you're going to get more for your buck, actually. Like some of the places are absolutely gorgeous, the adult care homes, and their prices sometimes are a little less expensive than ours because there aren't as many here, and there's a lot more in Phoenix. So actually some prices can be less expensive up in the Phoenix area than Tucson. But when I compare other states, Tucson is very affordable in comparison to a lot of the larger cities.
Okay. So places like Los Angeles or Vegas or something.
San Francisco, I just had somebody that I referred to a different placement agent because I am a part of a group called the NPRA, which stands for National Placement Referral Alliance, and it's an Integris group that's nationwide, and I can help people get connected with agents in other cities.
Oh, okay.
And one of the agents said, well, I hope they have a lot of money because San Francisco is very expensive.
Yeah.
So, yeah.
Okay, so you can, if someone is looking and they currently live in Tucson, but the family lives in North Carolina, you can, if they decide, hey, I want to go live closer to my family that's in the Charlotte area, you can get in touch with people that do your work in the Charlotte area, and you can also make things happen for them that way and work with them that way.
Yes, absolutely. Okay. And I can look at a placement agent that's in the NPRA or one that has a special certification, which I have. Okay. It's the CPRS. It's a Certified Placement Referral Specialist, and it's a test you take of over 100 questions. But those people have a lot more knowledge even than the regular placement agents. But they're all a really great group of people, and you have to take an oath that you're going to operate out of integrity with ethics, as well as having business liability insurance.
Okay, excellent. And what do you find are some of the questions that come up from the families when they're starting this process, whether it be about the communities, the time frame, financing? What are some of the main things that you feel like you run into?
I think the biggest concern is finances. Will they outlive their money? So I do know the communities that are ALTEX, which stands for Arizona Long-Term Care System. That's the Medicaid program. So there are those contracted homes and centers that in town that take that. And so if they say, we want a place where if they do run out of money, they can stay, then we can help connect them to those appropriate places.
Okay. And I know on the home care side often that we are working with different families in situations where it may not be the best choice for them to be at home at a given time, such as a time when memory care is at a point where it is needing more of a community, or there's times where you have someone that's extremely social and really wants that interaction. I know that we often will reach out to someone like you that will help in that process just because of the knowledge base, like you said, just of the group homes. There's 200, and if we had a family fly in from Chicago and say, okay, we need to go look at 200 group homes, that's just not going to happen.
Right.
But someone that can come in, take a look at the situation and say, okay, we're going to focus in on communities that have memory care and have good quality care, and we're going to look at the budget, and you're able to sit down in that situation, meet those involved, assess the situation, and take that 200, 300, 400 options and all of a sudden take it down to here's 3 or 4 let's start with and take a look at those. Right. And so for those that are coming in to assist family members, this could be a game changer, because instead of it being a summertime project, it's suddenly we're coming down to it can be handled usually within a week.
Right.
Talking about time frames, when you work with a family and they usually start to make a choice about we like this community or this center, how long are you seeing here in the Tucson area does it take for someone to move in, get all the paperwork signed, and kind of get set up in that community?
So the centers are taking a longer time than a home, and for the reason that once we tour and then they decide, then the nurse has to set up a time in her schedule to go and assess the client to determine what their level of care is and if they're appropriate for that community. And then once they do, then there's paperwork to be filled out, and then they have to furnish the apartment. The family has to furnish the apartment. So it's a minimum of a week to 2 weeks. Okay. The adult care homes, however, a lot of them are already furnished, and so that transition can be a lot quicker. They don't have to have a nurse do the assessment because I've already done the assessment and the homes trust what I'm telling them, and so then they move forward and get the doctor's paperwork filled out, and they all have to have a TB test before they move in, so that is required. Okay. Yeah.
And I know that a lot of us, when we talk about different resources we work with, we know different people that can help families move into like a center or a group home. Do those group homes or centers ever provide resources to say, hey, these are companies that can help us, help you move in? Do they do that during transition time? Are they open to different types of situation where they have home care givers that have been working with the clients, stay with them for like the first day or 2 or week to help them in that transition? Have you seen that where they're open to those types of resources?
Yeah, I have a lot of companies and resources that I work with, that I partner with, but yes, certainly they also will have people that they can suggest. And yes, there are many times when I have families that have a home care agency like yourself involved, and then they say they're really attached to their caregiver and they've bonded and they want to continue being with them for a limited time. So yes, they can follow to wherever they're going and continue services as long as they'd like. So,
great.
Yeah.
We have a family that is diagnosed, or they have a loved one diagnosed with a type of dementia, say Alzheimer's. Are there specific communities or group homes that either focus on that or can cater to it, or certain ones that you might just say, in this situation, I wouldn't go this direction? How do you approach that issue when we're dealing with dementia?
So there are the strictly memory care communities that take people with dementia, that they specialize in it. Their caregivers are trained to really be able to treat those patients with dignity and respect, and yet understand that disease process as well as keeping them very busy with activities all throughout the day. The adult care homes are also licensed for all 3 levels of assisted living. So you're going to have people with physical needs that are alert and oriented, but you're also going to have folks with dementia that are either independent or have physical needs. So they can be in either option, and they do a great job with taking care of them. Now, if they have some dementia behaviors, there are a few places that can handle that too, and that is going to be a different dynamic and a different community altogether.
Okay.
So
excellent. And when you're working, let's say you get a call from someone out of town and their family has had a diagnosis of dementia, what specific situations, or how does that affect you and your assessment, and also in how you select these communities?
So it depends on if they're social, if they're going to participate in the activities. I think a memory care community is wonderful, and providing they can afford that. They tend to be a bit more expensive than the adult care homes are. If they're more reclusive and don't like to be around other people, then really a home probably would be a better setting in my guesstimation. So it just depends on the finances, and then how they would respond to either place and what would be the best fit for them.
Okay, great. So if we had a situation where someone here in Tucson has been diagnosed with dementia, or maybe is already in the state of dementia, and they have family members that are out of town, and maybe they're calling for help, or we're in a situation where the local family is calling for help. How do you deal with the family in different places and the dementia situation all put together?
Yes, so that does come up frequently, and it is a great question. I think your agency provides case management and caregivers, so I recommend to families to hire a caregiver to go with that client to the doctor's appointments if they need to. If they're in the hospital and they need an advocate, they can get case management involved, or a caregiver to be like the advocate for them.
Yes.
So it's a great resource, and that's really needed, because it's a scary thing for someone with dementia to be out in a hospital setting, for example, and not have somebody have their back and be supportive of them.
Absolutely. Well, I really appreciate all this information that you have been able to share with us. And if someone was looking, maybe from here in Tucson or from out of town, and they needed to get in touch with you about your services, what's the best way for them to reach out to you?
I think our website would be the best. All the contact information is there, and it's aseniorjourney.com. So then we've got education on there, as well as the contact information. So I so appreciate you allowing me to share today, Mark. It's been quite a privilege, so thank you.
Well, I appreciate it. Thank you very much. And I appreciate all the help, and if you do need information regarding senior living placement, please don't hesitate to get in touch with Amanda or ourselves, and we'll get you in touch with her at any point in time. I'm Mark Schmidt with Home Care Assistance of Tucson. If you have questions about the difference between home care and health care, please stay tuned for a video that we have shot specifically addressing that question. Please remember to like and follow so you receive updated information on supporting loved ones diagnosed with dementia. Thank you for joining me.